So, good evening, everybody. My name is Liliana Ramirez Gomez. I am a neurologist, a doctor who treats patients with memory disorders and difficulties with their thinking, their behavior. I am also a physician scientist. It means like I also do research and want to find better treatments for patients living with dementia and their care partners. And today I am going to present to you during these 20 minutes that I have about thinking and feeling good as we age, strategies for self-care, how we can prevent memory problems, and what strategies can we use to maintain our cognition as we age. We know that the older adult population is growing, and this has been exponential. And we have been seeing in clinic more patients with memory concerns over time. And we know that there is also a higher risk of dementia here in the United States for people that are Hispanic, Latinos, or Blacks. So there are a risk that we have, um, and we want to make sure that everybody and all people from all races and conditions and socioeconomic status, etc., do the best we can to prevent cognitive decline over time. And people always ask important questions. Some of the most common questions that people ask is what's normal aging, what is not, what is part of the normal aging, what's the difference between Alzheimer's disease and dementia? Are they the same? Are they different? How? And the most important thing that we're going to discuss today is, can I do anything to prevent or delay dementia? And to start with the first topic is this normal or not? Everybody, as we get older, start experience difficulties when sometimes we forget where we put our keys or our phone. We get home after a busy day and put things somewhere and then we don't find them. Or sometimes we park our car in a big parking lot and we forgot which road did we park. So there are some changes that may happen. Sometimes they worry us, or sometimes we have difficulties finding words, among other things, that although they are happening, don't affect our performance on our daily tasks, on our living, on our work, on our ability to do all the things we need at home, etc. So those moments, sometimes people call them senior moments, but it has become important now to recognize those and actually to seek help. Sometimes it's more difficult to differentiate what's normal and what's not. And we need a little bit more evaluation to dig into that and find out if what we're experiencing may be normal part of aging versus not. When to worry. So memory loss and difficulties with cognition is not just forgetting. Sometimes people present with difficulties finding objects or finding things in the kitchen, their spices, or finding other things. Or sometimes they may have difficulties expressing their own thoughts. They have difficulties with language. Sometimes they have more difficulties with multitasking, planning, organizing things. Or sometimes they even have behavioral changes that are significant. So this is to say that not all dementia or presentations of neurodegenerative conditions are the same, and symptoms could be different. And that's the reason I would say when we encounter any of these problems like memory loss, problems with language, getting lost in familiar places or misplacing things more often than not, changes in behavior like loss of initiative or other changes, it's important to seek help because it's better to find out early if this is something serious or not. And with good guidance, we can find an answer. To answer the question about dementia and Alzheimer's, those two terms are different. And dementia is what we call an umbrella term, meaning that is a name that encompasses several diagnoses. This is to say that dementia is non-specific, it's just the name of a condition, of a syndrome. This means that people need help in their daily lives, that due to changes in their cognition, in their memory, in their language, in other abilities, they cannot perform well on daily life and they need help to the point that they wouldn't be able to be safe without the help of others. And there are different types of dementia. Alzheimer's is one of the most common ones. There are other types, such as vascular dementia, frontotemporal dementia, dementia with Lewy bodies, or sometimes people with Parkinson's disease that later on develop cognitive decline. And one example that I give to people is dementia is something similar to say that someone has fever. We can have fever for many different reasons because we have pneumonia or because we have a urinary infection. So fever is just a symptom, similarly to what we call dementia. And we always have to do more workup to find out what's the cause. And that's what we need to find if it's Alzheimer's or if it's vascular or if it's mixed, etc. There is a continuum. So we know that as we get older, and this is we see here in the horizontal plane, there may be changes in cognition, and that's the reason we see in the vertical axis that there is a decline over time. But what happens with normal aging in the red line is that the decline is small, minor, not significant. It doesn't really lead to someone losing their ability to be independent, to do things on their own. Instead, people with dementia have a progressive cognitive decline that it tends to be slow, insidious, until they get to a point that they meet criteria to be called dementia because they really need significant help in activities of daily living. But what we can see in this graph is that it goes through stages. It grows from an asymptomatic phase, and this phase is one in which the researchers, we have learned that there is a period in which in our brain we start accumulating pathology, but we don't have any symptoms yet, to the point that there is a critical threshold in which that pathology accumulates to a certain point that the symptoms become obvious. And when they are mild, we call them MCI or mild cognitive impairment. And as they progress over time, they progress to dementia. And this is critical to pay attention to because we have a window of opportunity in the early phase of the disease to identify if there is this accumulation of pathology and perhaps way of intervening. Right now, we don't have a cure for Alzheimer's disease, but we do have treatments that could help delay and slow down the progression of the disease. And usually they are used in the phase of mild cognitive impairment or very mild dementia. But in this phase of the very early asymptomatic of early symptomatic, there are opportunities to participate in research. And that's the hope that we carry with us. And I carry with me when I see patients and when I am telling them about the diagnosis, but I tell them also we have hopes. And that's the reason we do research to try to find a cure. And people also ask, can we delay or prevent dementia? And people read all different things on the internet. There is a picture here of turmeric, different vitamins. People read books, and there are a lot of things. Now we need to be very conscientious about where do we get our sources of information, because it may be that a lot of things that people share on the internet or even that we find over the counter at the pharmacy, they don't necessarily help. And also there may be an opportunity that people are making business without really doing something that could be beneficial for you. So I'm going to discuss here pathways to prevention, pathways that have been studied scientifically, that we have evidence for, and that would help us to maintain a good cognition, the best that we can. There are many things that we can intervene and control, and things that we can help ourselves to delay symptoms like memory loss or cognitive decline. But there are other factors that we are not going to cover today, perhaps in future presentations, that are genetics and other conditions that we don't modify. So we divided in two groups: modifiable risk factors, those that we can intervene, and non-modifiable risk factors. And that's an example of genetics. But today I'm going to focus on the modifiable risk factors and things that we can.
Dr. Ramirez, could you please try to speak a little bit slower because Claudio is having problem
Oh,
following you. Thank you.
okay. Yeah, sorry about that. So there are things that we can do to maximize our brain healthy behaviors. One of those is diet, and that's the reason we put a picture there of fruits, vegetables, exercise. And I want to be sensitive here and mention that sometimes people say, how can I afford a healthy diet when that's very expensive? And eating fresh fruits, or there are things that I may not be able to afford. And I want to be sensitive to those issues and say that we have options to choose. But sometimes, of course, we are in hard situations that we don't have that opportunity. But the message here is not to say that this is the only way. But if you are here, I think it's because you are worried, you are interested, you want to learn how is that we can take care of the brain. So we take what is good for us, what we may help, and things that we can use in our daily life. Um, so we have here a summary of what we call the brain healthy behaviors. And this is a busy slide, but I want to share with you one by one because we know that one single thing is not going to change completely an outcome. That is most likely that the combination of several things, as what we call lifestyle, is going to help us achieve our goals. And it's very important physical activity, exercise of any kind, and we are going to talk more. But something simple like even walking or doing exercises like in a stationary bicycle or some strength training on stretches, things like that could be helpful. It's very important to follow a healthy diet. And when we talk about this, it means eating more fruits, more vegetables, eating less fats, less red meat, all of those things that we are going to explain a little bit more. Being socially active with your family, with your friends, with your neighbors, with your church, with societies that you may be part of, with your community, because this is important for our brain. Staying cognitive active and always challenging your brain, learning new things, taking classes online, reading, doing puzzles, things that challenge you and keep you engaged. It's very important the sleep, and sleep hygiene is important, and we are going to give some tips today also about stress management, medications, and overall health. And here we have a picture of someone exercising, and he's very excited about it. And this is to say that it doesn't matter at any age, we can always start exercising. Even if we feel that we are in our 40s, in our 50s, that we'll never learn how to exercise, it's important that we take steps. And first, I know we contemplate and we start realizing that, yeah, people are talking about this because, yes, it is very important. And there is evidence that it can really help with your cognition. And of course, in addition to your physical health, your sleep, and even your mood. What are some of these physical activities that are recommended? In general, it's good to practice exercise every day for 30 minutes for at least 5 days a week. But of course, if you have never done much of exercise, I always tell people you can start with 10-minute walks and incrementally go for longer walks every day or every couple of days. And to the point that you may be able to walk longer distances or engage in activities that are more vigorous. But this is something that we can do incrementally over time. And if you have some advice from friends, or sometimes people join a gym or join classes or join senior centers, there is an advice that tells you to do some vigorous exercise to a point in which your heart is pumping a little bit faster. Of course, we always have to be careful about any medical conditions that you may have, but in general, it's good to increase your physical activity over time. And there are many things that one could do. Some of those include aerobic exercise, And this you can do at home if we are here in Boston in winter, for example, if there is an opportunity to have a treadmill or an elliptical, or even if you don't have any of that, don't worry. You can always put a YouTube video and join your dance class, your Zumba, anything that would get you pumping. And if you have any physical impediments or difficulties with the movements or pain, you can even do chair yoga or find activities that are good and safe for your body. Of course, if you have a nice weather outside, enjoy and go outside, go for a longer walk or jogging if you can. These days, people are playing pickleball or other activities, anything that you enjoy. And that's the important thing, that you enjoy it. Talking about healthy diet, we come back to the topic of eating more fruits, more vegetables, and less saturated fats, less red meat, more fish. So this is important because there have been a lot of studies that have shown that following a healthier diet has a lot of benefits for the health, not only for the cardiovascular health, but for brain health. And in general, we are hearing a lot of the term inflammation lately, like the anti-inflammatory diet or that inflammation increases the risk of this or that. But in general, we want to follow a healthy diet. And in green, we put here that things that are recommended that you eat every day, like fresh fruits, vegetables, beans, lentils, grains, fish, whole grains, olive oil if you have the opportunity. And in moderation, meats like poultry or eggs or dairy. We also recommend avoiding a lot of sweets and refined sugars, red meat, saturated fats. And I know this is hard. And usually, I don't tell people they need to change their life upside down one day to the other. But as we become more conscious about healthy habits, we start choosing healthier options every time. So that's what is important to remember today. There are diets that you may read about, like the Mediterranean diet, the DASH diet, and others. And there have been many studies, as we are sharing here in the slides, on more than 2,000 people in community who don't have any cognitive symptoms that have high consumptions of this diet style that has lower rates of cognitive decline over time. And what this is that we recommend people being active, physically active, enjoying meals with other people, with good company, eating more fruits, vegetables, whole grains, fish, and in less quantities, poultry, dairy, etc., and the lower amounts of meats and sweets. I know alcohol is one of the a little bit controversial, I would say, because for a long time, we have understood that perhaps drinking one glass of wine per woman or two glasses for a man may be healthy to a certain point. Over time, we have been learning that as we get older, alcohol may not be healthy. And in fact, I want to share with you that as a neurologist, I do share with my patients that present to my clinic with cognitive decline to avoid alcohol because when you are already experiencing symptoms of cognitive decline, memory loss, you don't want to be putting those things in your body that definitely are not going to help you live a healthier life over time. Similarly, we have to be active cognitively, and that's the reason we have a chess game here, because it has to be something that challenges. And it's better if we can do it in social environments, in communities. And a lot of these things are played if you have like a lot of family, friends, community centers, church. It's fun to have these activities. Sometimes people take classes or enjoy hobbies, but something that enhances like socializing community activities and at the same time challenging your brain is a very good combination. So, can we increase our brain reserve? Probably you have heard that we can grow our muscle. And how we do that? We do strength training, we do things to stay healthy. And you have seen sometimes the muscular guys. And that's just to put an example that, yeah, we can also train our brain. And one of the things, of course, that sometimes people may not have had a while back access to was, for example, optimal amounts of access to education, for example. And I say that I'm from Colombia, a country that during many years, people may not have had access to a full education. And for example, my mother, who is 86, only had access to 2 years of elementary school in a rural setting. And now we learn, for example, that education is one of the factors that helps us build our brain reserve, build our muscle, having more connections, more synapses. That's what brain reserve is. Probably you may have heard about the term resilience. That resilience is that capacity to endure certain damage without showing symptoms. And that's what the brain does when we make it stronger. Not only, as I mentioned, it could have been with education, and the more you study and learn, it's good for your brain. Similarly, with our healthy diet, with exercise, with activities. We know that depression, as we are going to hear later, is important to treat because it may affect that reserve, among others. So let's talk more about this. When I talk about cognitive reserve, means that we start at a higher point, meaning that, for example, someone is a high endurance athlete and they are able to run a marathon easily when they are highly trained. But over time, they may lose some of those endurance, but they are still able to run a 5K very easy because they have run marathons before and they are very well trained. Similarly, with our brain, for people that have a lot of cognitive reserve, they may be able to sustain higher loads of pathology in their brain and not showing any symptoms. So, what happens, for example, is in our clinic, sometimes we see people that come relatively looking good, like you wouldn't see or think that they have severe dementia or a lot of symptoms. And when you look at the brain scan, you see that there is a lot of atrophy. But what happens is that they have a lot of synapses and connections in their brain that has helped them endure certain amount of damage without showing symptoms until they reach a certain threshold. And many factors can contribute to that reserve, including high educational attainment, participation in cognitively engaging activities, maintaining a large social network, managing the modifiable health factors, as we mentioned today, and cognitive training, among others. There are things that may affect our brain reserve as well, like they are things that enhance it, and there are others that lower it. Some of those could be that there are also medical conditions that make us more vulnerable, such as diabetes or high blood pressure or hypercholesterolemia or other cardiovascular risk factors. If we have poor sleep hygiene or people that may have sleep apnea and we don't treat it, or other conditions that affect also our brain health, difficulties with nutrition, or poor choices that sometimes we make that are not so healthy, problems with substance abuse or smoking. If we have depression and anxiety, of course, we're not guilty of feeling those things and suffering those illnesses, but it's important to look for help. Similarly, stress, and we live in a world with so much stress. We all go through a lot. Every day we need to do more and more and more. And it's something that we need to pay attention so we can um, improve our lives as well. So, in conclusion, there are many things that we can do to take good care of our health, meaning managing our stress, our diet, our exercise, and all the things that we mentioned, including our sleep hygiene. And I am going actually to stop there. I want to share some numbers. It's important if you have high blood pressure, high cholesterol, diabetes, and other conditions that you seek medical treatment for it and that you keep them under control. And with that, I'm going to stop sharing and give a space to Dr. Jinju to her presentation. Thank you.
Dr. Ramirez Gomez. So let me share mine. It's same. Okay. All right. So, what's going to be really interesting is that there's going to be some overlap. we, as psychiatrists and neurologists, we're both kind of in the brain. It's possible that as when you think about mental health, you may not necessarily be thinking about that. But emotional self-care is part of brain health. So I think depression is in the language, it's colloquial. People kind of have an idea of what it is, but I wanted to go into a little bit more detail. So often people know of depression as something that's about mood, feeling down. Um, in mild stages, it might be just the blues, feeling a little sad because something stressful happened. In later stages, it could be feelings of worthlessness and hopelessness and really low self-esteem. So depression, whether it's mild symptoms or if it's really severe symptoms, is really very closely linked to cognition. So a lot of studies have shown that it's related to memory, it's related to processing speed, it's related to executive function. The kind of symptoms, psychiatric symptoms that you may have that we also consider cognitive is that when you're feeling down, most likely you're also going to be having thoughts that are very negative, thinking that nothing, there's no hope, that you will never get better. And sometimes there are thoughts of suicide. And I'm going to kind of discuss a little bit later what types of things, we can think about in terms of self-care and prevention. So again, kind of physiological and behaviors. So poor appetite, disrupted sleep, either a little too much or not enough, and what we call psychomotor retardation, meaning your thoughts may be slowed, your movements may be slowed, and there's social withdrawal. So sometimes some of my patients who have depression say that they don't have the energy, for social interaction. And they feel guilty sometimes that they're not able to summon that energy to be a good host or to be a good friend. So other things to think about are, what are your potentially medical conditions that could be contributing? So I just name a few things here, but there are really many. So hypothyroidism, and that might be something that your primary care doctor, or if you end up going to a specialist, might have checked. Lung problems like COPD, as well as kidney disease. So these are things to think about, is depression isn't just about mood, it's about thinking, it's about also physiological symptoms and behaviors, and it also could be impacted by your medical conditions. So depression, as I mentioned, and cognition is very closely linked, and it's not just severe depression or even clinical depression, but when there are studies of cognition where persons with depressive symptoms compared to those who don't have any are tested cognitively, then there are differences. And this is just a percentage. Mild cognitive changes in depression can range from 30 to 50%. So to not necessarily take the percentages literally, but to compare to, let's say, if it were 1 or 2%. So it's a pretty substantive amount. So cognitive changes in depression are linked very closely. As I mentioned, it can affect memory. So, recall, being able to remember someone's name, to remember what you did 2 weeks ago. Also processing speed. So it may be that things may take you a little longer to do. In social interactions, it could be that a conversation takes a little longer for you to register, understand, and then respond. And then it could also affect executive function. So these are kind of higher level thinking skills that are useful for planning, a wonderful trip to Europe or to the mountains, or multitasking, juggling several things all at once. It takes a lot of kind of thinking power to do that. And you may have known or may not have known that with depression, a lot of studies have shown that there are changes in brain structure. So one of the common parts of the brain, the hippocampus, is considered to handle memory, or encode memory. And depression has been shown to decrease the volume of that particular area of the brain. So again, depression is mood, it's physiological, it's definitely related to brain health and related to kind of the structure of the brain. So anxiety and depression are really also closely linked. Sometimes patients will ask me, well, I feel anxious, but I'm not depressed, or I'm depressed or not anxious. And sometimes when I probe a little bit more deeply, it's really both. Sometimes they will have say, well, one is a bit more predominant than the other, but it often goes together. And anxiety kind of in what distinguishes it from depression could be that there is a lot of worry, a lot of fear, and an inability to relax. So there's a general feeling of tension. And just like depression was both mood, it was physiology and somatic symptoms, bodily symptoms, as well as cognition and behavior. So anxiety is similar. It has those similar dimensions. If most people have felt nervous or anxious, and you probably have experienced, kind of a nervous stomach, if it's heart racing a little bit, maybe even a little shorter breath. If you're, have stage fright and you have a huge audience that you have to give a speech to, you may become a little shorter breath and very, very nervous. And then you may become really distracted because your attention now is impaired, and it may be really, really difficult to concentrate. And so there is a lot of it could be that there are a lot of thoughts that are in your brain that you just can't control when you're having anxiety. And when this kind of peaks, it could also be like a panic attack. And often the behavior is to avoid these, whatever is causing you nervousness, whether it's public speaking events or whether it's blood. Some people faint when they see blood. They may have a phobia. So most often they avoid because it causes them pain, emotional pain, which is anxiety. So for depression and anxiety, and it comes in it could be really mild, it could be moderate, it could be severe, but in terms of kind of brain health and prevention, it's really, really good to try to identify it early, or to be self-aware, and not to dismiss it as something that you're just going to be kind of strong and tolerate. So social isolation, very, very important for both dementia, cognitive disorders, and depression. Sometimes people call depression loneliness, and it's very prevalent, and it's really gotten worse since the pandemic. So about a quarter of older adults, age 65 and older, that's one statistic, are considered to be socially isolated. And again, it's closely linked to depression. There are a lot of studies that have shown that it's also linked to dementia and cognitive disorders, not just dementia, but also mild cognitive impairment. It's also linked to poor physical health. And I'm going to be talking in a couple of slides about stress, which Dr. Ramirez Gomez mentioned already. Isolation is a huge stress. It's painful, it could be, and it could lead to stress reactivity, and also, if it's chronic, physiological damage. So there was recently a study that came out last year, which looked at over 5,000 socially isolated older adults. It was nationally representative, and they followed them over 9 years. And the statistics they found was that about a quarter reported social isolation. And when they followed them over 9 years, what they found was that the risk of those older adults who were socially isolated was about 27% greater. So these studies, you can't kind of extrapolate and say, oh, my risk of dementia, because sometimes I feel lonely, is quite high. It's like 1/3. It's more like it kind of gives you an idea of how important or how seriously to take it. because you as an individual are a person with different genetic risks, with different life factors, with different medical conditions, different attitudes and self-care practices. So it doesn't mean that you have that particular risk factor, but it just shows you how important social isolation and feelings of loneliness are. So what I wanted to do is just introduce this idea of allostatic load or allostasis. It's kind of a way of thinking about stress, which was already mentioned. So everybody knows stress is something to avoid. Stress is something to, decrease. And I just kind of wanted to share with you this kind of concept of how some scientists think about it. So the body, both physically, emotionally, mentally, we're always balancing challenges. Life is hard. There are challenges coming from all over the place, your family, your job, uh, your medical conditions, process of aging, all of those things can be really stressful. And so those could also major life events. Major life events as one ages could be loss of a spouse. It could be retirement. It could be as you get older that kind of you're diagnosed with more medical conditions. There also may be some trauma or abuse that happened in adulthood or in early childhood. And though all of those things are mediated through the brain, the command center, and the perception of that stress is really, really important because it results in physiological responses. So you may have heard of cortisol, which is a substance in the body. And when stress results in the body, cortisol is often elevated. And sometimes when you have chronic stress, which could be 6 months to a year if longer, let's say, for example, you're in a bad marriage and you have continuous stress over many years, maybe it's an abusive marriage, or if you are in a workplace where it's quite toxic and we spend so much time at work, and the relationships that you have are very, very stressful. So chronic stress can be really damaging physiologically and emotionally. So what happens as you follow the arrow is that it can lead to end organ damage. So stress can lead to skin issues. I mean, a whole host of issues that really affect the organ systems of the body. So that's a good way to think about it. And when you think about emotions and feelings, it's not just emotions and feelings on one level. It's also potentially an indicator, let's say depression or anxiety, of your body and your environment, whether it's aligned with it or whether there is undue stress and feelings of being overwhelmed that need to be addressed. Because if it's not, if it remains chronic, then it could be that it's damaging you physiologically. So now we can turn to, what do you do to prevent all this? It seems so challenging. And Dr. Ramirez Gomez talked about lifestyle factors. And, there's some studies that say up to 60% of kind of our health could be prevented if we adhere to good lifestyle factors. And often doctors say some of the medical conditions of adulthood are really related to lifestyle habits. But what does it mean emotional health? What lifestyle things do you worry about there? When we think about physical health, you think about salt, exercise, good eating, and all of those things definitely contribute to emotional health as well. Whenever I think about health, I don't think about well, I do. I think about organ systems specifically like the brain and the heart. But I also think about how they all interact. And so depression and medical conditions, they interact. They may reinforce each other or be mutually impactful. So for example, pain and depression can mutually reinforce each other. Pain and COPD, same. Depression and cardiovascular disease also can mutually reinforce each other. So what are some things? And they're not unfamiliar to you, I'm sure. It's contained in self-help literature, right? And you hear about it in the news or in columns in the newspapers about how to care for yourself. And I think it's not necessarily that it's esoteric, unknown information. It's really more kind of motivation and how do you do it? How do you do it consistently so that your health is optimized? So these are things that Dr. Ramirez Gomez mentioned already. Lifestyle factors like balancing your stress, controlling your health habits, definitely seeing your doctor regularly, and getting really, really good sleep. And so prevention, I think for me, it's about not waiting till things are bad. And sometimes when mental health is concerned, people can wait. Not just depression, though. I mean, sometimes, depending on your circumstances, you might just not see your doctor for various reasons. But I think the primary thing that we have to do when we think about prevention is take symptoms, even if they're mild, and address them and take action and cope actively. So again, a lot of studies that show that active coping is more healthy than passive coping. So again, not unfamiliar. Feelings are important things, so don't ignore them. People have a tendency to think that they're not as good as thinking. They lead you astray. But another way of thinking about it is it's a method that your body has in a way to see how you're doing in terms of that balance between the challenges and well-being. So really, really very in vogue and common these days is mindfulness, kind of being in the moment and meditation. I often tell patients, you are what you think. So if you're someone who sees the glass half empty, you don't have to resign yourself to that. You can try to make some changes, kind of be intentional about realizing that that is your tendency, that it's not necessarily healthy in the long run, but maybe make some small changes to try to counteract that. Not everything can be problem solved, so accepting what you can't change is, in later life, as a geriatric psychiatrist, I encounter that a lot because a lot of patients, aging can be really, really difficult. I mean, I see it as something that takes a lot of courage. And sometimes, it's unpredictable and something you didn't expect. I think it's really hard to know how aging is going to turn out. And so it's very difficult to accept. But sometimes acceptance is the only way to have some level of peace. And then, as was already mentioned too, social connection. I mean, social isolation is so detrimental, and physical social activity is so important. And some of the mechanisms of that is that when you're socially isolated, you really don't have the inputs that you might get from others, conversation, doing physical, even social activities together. And even when you do exercise, often it's the social activity and the connection that gets people to do it. And so it's really, really important. And that's definitely something that I, remind my patients. The other thing also is I see is accepting and providing social support. So sometimes it's hard when you've been such a high functioning, independent person throughout your life to suddenly, like in later life, feel like you have to depend on others, even for the smallest, slightest bit. And so I often encourage my patients too to, let your children know that you may need a little help or to let them know if you're not feeling too well. But I often understand, there could be pride there, or there could be relationships that are complicated. But it's also, I think, a part of kind of emotional self-care is to not take advantage of others in a good way, to provide yourself some support and express your stress. So doing that, whether you do it whichever way you find helpful. So sometimes people love writing, sometimes people love dancing, sometimes through music, sometimes through conversation. And we all know from our own experience that if you don't express your stress and you kind of keep it in, then it really doesn't go away. Repression is not a good thing. And so expressing it is just the first step, but then after the expression, then it's a very good idea to think about, considering making a small change. And small changes can accrue and become big changes. So I think that's the end of the presentation part, and we wish we had a little bit more time, but we do have a few minutes. I'm going to give the floor to Paula because she has some information